before, but perhaps not the two of them together. So this is Susan Sontag in the left. And she says, everyone who is born holds dual citizenship in the kingdom of the well and in the kingdom of the sick. And although we all prefer to use the good passport, sooner or later, each of us is obliged, at least for a spell, to identify ourselves as citizens of that other place. And Susan Sontag was writing about cancer, but it's equally true about mental health.
Yep.
We're all going to have moments when we're thinking about mental health as a patient or family member or caregiver, in addition to other roles that we might have as a clinician or researcher or advocate. And so it's that spirit of bringing all of our identity to the room that we come together with, that will ground kind of like the language we use and how we listen to the stories that are to come. And it's been such a privilege to have those kinds of coming together with all of you. So that's kind of the overarching guidelines for how we think about like the kind of language that's helpful to use today. And we'll talk about that more going forward. I just wanted to take that moment of grounding. And on the right, another way to think about that is that, you know, any limitation also can be beautiful. What can happen when we're not just trying to accommodate disability, but we're making it beautiful. If you haven't seen this video of a gravity-defying wheelchair dance, it's really cool what can be possible when we don't think about limitations and instead think about strengths. So with that said, I'm going to ask if you're not speaking to mute, and I'm going to turn it over to Dr. Carrie Murphy, who is a psychologist, who's going to lead us in a reflection and self-compassion exercise to start today.
Thank you, Kelly. Hello, everybody. So we're going to start today. We thought it was fitting with a kind of a mindfulness, self-compassion meditation. I think a lot of people here on this call and a lot of humans in general are good at giving compassion to others, but maybe not as natural at giving it to oneself. So one definition of compassion is concern with the alleviation of suffering and being warm and understanding towards that suffering. And so self-compassion is turning that inward. And there's been a lot of research as of late, you know, that the development of some self-compassion can really increase our own positive well-being. It can decrease anxiety and depression, and also decrease compassion fatigue and some burnout. And I think we can all agree that this last year and a half, and still going, has been quite challenging and painful and difficult for many of us, particularly in the world of healthcare, in which many of you on this call are deeply engaged and familiar. So this exercise is for all of you, all of us, and I invite you to just arrive here, get comfortable wherever you may be, sitting, laying down, standing, close your eyes if you're comfortable, and we'll start with maybe a couple deep breaths together. So this is a version of self-compassion designed to bring in some tenderness, some loving, connected presence when you're hurting or struggling in some way. I'm going to invite you now to think of a situation in your life where you are in some need of some care. Maybe you're feeling inadequate in some way, feeling badly about a failure or a mistake you might have made, or just something about yourself you don't like. Maybe there's something very difficult in your life that's stressful or challenging right now. I want you to allow yourself to feel your way into the situation. What's going on? What are you feeling? Also feeling the distress in your body if you can. So dropping out of your head for a moment and into your body to really feel the discomfort. And now we're going to bring in the three components of self-compassion, starting with mindfulness. And mindfulness, when it comes to tender acceptance, it's really just about being present what is. Being present with yourself, validating the pain, and saying something to yourself along the lines of, maybe this is really hard to feel this. To experience this moment is painful. It's a moment of suffering. And also at the same time, reminding yourself of your humanity, right? That feelings like this, situations like this is all part of being human. There is nothing wrong with me for feeling this way, and I'm certainly not the only one. Allowing yourself to feel that connectedness to others in your own imperfection. And then finally, we want to bring in some kindness. So one way we can do this is with physical touch. If you're comfortable, you can try putting your hand on your heart, or perhaps you might want to cradle your face gently and feeling the warmth of your own hands and saying something kind to yourself, which is exactly what you need to hear in this moment. Maybe it's a message of acceptance, such as, it's okay to be imperfect, or a message of support. You can even say your name to yourself. You know, I'm here for you. It will be okay. And if you aren't sure what to say, you could imagine what you would say to a really close friend who is in a very similar situation. Words of care and comforting that you use to help a friend, and then try saying something similar to yourself. Now, we'll be letting this practice go, allowing yourself to be exactly as you are in this moment. And if you're feeling any distress, you can always try grounding with your feet on the floor or feeling your sit bones wherever they may be, and coming back to this moment, gently opening your eyes. I hope this is something you might return to here and there when you're having a moment. And I'll go ahead and throw the link to some great self-compassion exercises into the chat box if anybody's interested. Thank you.
Thanks so much, Carrie. Really appreciate you starting us off with the self-compassion exercise. It is absolutely much needed, as Amy noted in the chat, so much appreciated. I have such a privilege to introduce Laurel Skinnell, who is a participant in our Bridge trial of collaborative mental health and cancer care. She is many things, as she will tell you, but what I can say is just that it's been a privilege to accompany her over the past 18 months, and we're very grateful to her for sharing her story today.
Hi, thank you so much, Dr. Irwin. I'm Laurel. I'm 27 years old, and I'm a stage 2B invasive ductal carcinoma survivor. In November of 2019, when my daughter was just 2 months old, I went to my primary care physician's office for a lump I found while breastfeeding. I met with a nurse practitioner who assured me that the lump was just breastfeeding related, that she herself got them from time to time. She put in for an ultrasound just in case, but there was no rush. There was a rush. I noticed a dimple in my breast the next day when stepping out of the shower. I called the office. Still, there was no rush on her end. I fought hard for them to fit me in. I needed to know she was right, that it was nothing. When I did go in for the ultrasound a few days later, I left the office in tears, continuously staring at the patient portal that reiterated what the radiologist had just said. 1.8 by 2.2 by 2.6 centimeter irregularly shaped hypoechoic mass with speculated margins and posterior acoustic shadowing, followed by BI-RADS 5, highly suggestive of malignancy. Trust broken. This isn't what I would call fine. I met with so many doctors in such a short period of time, I can hardly remember them all. But what I do remember is wondering if they were making the right call, if what they told me was true. I second-guessed everything and everyone. In what felt like a matter of a few seconds, I was now coping with cancer, being a new mom, and battling a ruthless eating disorder all at the same time. And the country was starting to shut down. I didn't want to acknowledge that I needed more than just an oncologist, but it was clear to everyone else that I needed psychiatric care. I needed a team. How on earth am I ever going to trust someone again? Never mind through a camera, I thought to myself. Truth is, at first I didn't trust my psychiatrist at all. I was very disconnected during the calls and just eager to hang up and get on with my life. I didn't want to rehash my trauma or try medications in hopes they'd work. The weeks passed by and she kept showing up for me. She listened to me intently. She validated me. She shared her medical opinion, but reminded me of my bodily autonomy. She even drove an hour out of her way to come meet me during my third chemo cycle, right before things shut down completely. I never asked her to do that, but she did. She gave me a safe space when the world felt anything but safe. She showed me that two things could be true at once. She showed me patience. She showed me she cared. She took time out of her schedule to return my calls whenever I was distressed. I remember the day she sent me a text and asked if I wanted her to come see me while I was in a holding room waiting to be placed in a psychiatric unit because being alive seemed like too much of a challenge. She had been the one to section me. She knew I was mad at her for it, but still offered to come talk to me anyway. I knew I trusted her when I said yes. I knew I trusted her when upon my second time meeting her face to face, I felt soothed by her presence. She was kind, sometimes fiery, and also caring. She didn't let me sneak things by her. She called me out on my poor decisions. She was real. She gave me words that I could hold on to. She showed me that developing a trusting doctor-patient relationship was possible and allowed me to let my guard down enough to meet with other practitioners, both virtually and in person. She allowed me the hope that I could trust again. I'm still working on that though. I still scour every detail in the patient portal to double, triple, quadruple check that what my doctor relayed to me is right. But because of her, the hope is there. I wish I had a concrete list of qualities and behaviors a medical team should give patients in order to establish trust, but truth is, trust is earned by different people in different ways. What I can tell my fellow patients is that your team works for you, and don't forget that. If your team doesn't make you feel cared for, if they don't listen actively, if they don't respect your decisions, hire a new team. There's no shame in that. Not everyone's going to be your cup of tea. I'll leave you with this. While it's hard to live in this new hybrid meeting era, it is possible to provide and receive a high level of medical care that nurtures the patient-doctor relationship with the attention, compassion, and patience you would expect in an office visit. I did not think I could establish trust with another medical professional again, but Dr. Kelly Irwin proved me wrong and has given me care beyond what I could have ever imagined. Thank you, Dr. Irwin, for all the days you were patient, the days you were kind, the days you listened, and the days you called me out on my decisions, even when I didn't like it. I can say from the bottom of my heart, I would not be the woman I am today without you. I hope to all the medical professionals out there that you can learn a thing or two from Dr. Irwin. And I hope all the patients out there that you find your Dr. Irwin. Thank you.
Thank you so much, Laurel. I think it's good to just take a minute, to take it in for a second. It's so, it's such a gift to, for me, but for all of us to hear that you can hold all of those things at the same time and come through it together. I think that's so important. And I think that that's a really big part of trust, which is something that we'll be talking a lot about today. What are the key ways we can build trust? And I think that relationships are a really cross-cutting way to try to get there together. But I really appreciate you being here and being part of the breakout sessions going forward. And hopefully this can help to spur dialogue today. We wanted, of course, we wanted to next highlight another narrative of a caregiver who has worked really hard to accompany his wife across many care transitions during this past year. It's been a hard year for caregivers. You haven't always been able to be there in person. There's been isolation. There's been a lot of worry, and there's also been the potential for growth. So I want to turn it over to Carrie Murphy. And, it is exciting to me also to introduce Eric Worth. Thank you, Eric, for being here.
Yeah, thank you.
So Eric and I have had the chance just to check in by phone, I'd say for the last several months. Pam is no longer part of the study, but it's something that we've been able to do. I think something to highlight around, it transitions to care, that there's not a lot of resources, and we've been able to do this by virtue of philanthropy and grant work and Kelly and her team's just great work and care and connection and continuing to support people even past passed the study. And so Eric and I have checked in, and I've been really just struck by his caregiving for his wife, Pam, through multiple transitions, hospitalizations, surgeries, rehab, back home. And we thought today that Eric might be able just to share some lessons learned from these experiences, particularly during COVID, which has been challenging in so many ways. So Eric, I'll turn it over to you, and love to just hear some of your thoughts and reflections.
Hi, can you hear me okay? Okay, good. Okay, yeah, it's been really tough. Pam has been through a lot. My wife, Pam, that's my ID on the picture, but she's been battling cancer for maybe over 20 years, 25, 30 years now, with many vaginal excisions, with a very slow growing cancer that keeps recurring, that she has to go back every now and then to get another excision. And recently, a couple of years ago, she had a lumpectomy that was all negative margins, and a lymph node biopsy that was negative. So that's how we got hooked up with the cancer program. But since then, she's been on the decline to a large extent. She had a number of accidents, a broken arm back in October, which was from a fall on the stairs. She didn't remember, I believe, and there were no witnesses. And that put her in the hospital and because it was arm surgery, the anesthesia affected her breathing and her heart rate, so that sent her to the ICU for several days before she was able to get back to rehab after the arm surgery. She healed from the arm surgery really well. The rehab was really difficult because that's where I first encountered the COVID-19 restrictions, and there was no visiting virtually, maybe once a week. At first, it was like a half-hour visit allowed, which made telephone conversations with her really imperative, which weren't always reliable. Sometimes the phone wasn't near her to answer. Sometimes it wasn't working. And it was really difficult time at that time. She finally got out of rehab. She was there for a couple of months. And then there's several trips back to the hospital for different breathing, low oxygen saturation. She has a severe COPD, as well as the cancer, and also heart failure, and congestive heart failure. And so it's this number of trips back to the hospitals where they may have been visiting or not. I was really grateful when there was visiting available. I was able to spend time with her so that she wasn't. Through all this, there's been a certain amount of diminished mental capacity, along with her severe depression. She's losing some of her short-term memory, which makes it more difficult for her to keep track of time and places where she is. And there's a lot more confusion these days, which is a lot harder for her when she doesn't have any contact with family or friends. And then most recently this summer, she had another accident where she broke her jaw. And that sent her to the hospital again, but this time to Boston Medical Center, where they kept her on a breathing tube for almost 3 weeks with her breathing problems. And the atrophy that went along with that, much weaker. Now she's home in bed, and she has become incontinent now. And so it's become quite a strain, but glad to have her home. Even with all the restrictions and the limited visiting, it's good to have her back home. And I feel like I can, and she seems to be doing better. We're also having to work with the medication changes that not all the hospitals agreed with the medications she was taking, especially her depression medicine. Excuse me. And so it's been a struggle that way too, where I believe actually some of the depression medicine has actually enabled her to be able to function, be able to get out of a wheelchair even. And without it, her anxiety from her depression would be overwhelming and not allow her to get up. And also I think contributes to her incontinence. So we're still working on that. But yeah, it's been a long year for me. What a roller coaster ride. A lot of, when she was in life care and over New Year's, she had something happened that I never understood what happened. And she ended up being rushed to the emergency room in Salem, where they immediately med flighted her to Mass General for, again, she was in the ICU for breathing and a number of days there where she was recovering pretty well, but it was really hectic. And several times I had to get calls in the middle of the night, asking me if I indeed wanted to honor the DNR that was on her medical records, and which was a shock to me. And I had to, 3 times I had to tell them, no, it's okay to resuscitate her. But it's been it's been a real roller coaster for me, and what an up and down. And I'm really grateful for the help that Dr. Irwin helped us in contacting her when she was in life care back last December. And that was a source of comfort for her. And she's been helpful with me with reestablishing her depression medicine, and which I think has made a big difference with her ability to be able to even get out of a wheelchair. And I'm very grateful for that. And yeah.
Eric, can I interrupt and just point out a couple things as someone who's kind of chatted with you along the way through some of these transitions? Is I think for everybody here, figuring out how to show up for somebody during COVID and in between is incredibly challenging. And I've just been struck by your adaptability, your flexibility. And I think, what we've talked about a lot is just your humor, trying to find the lightness, when you could, and also just meeting the moment. And I think that's a lot easier said than done. But, when you could go to the hospital, you would show up and go for 8 hours a day. And then when you didn't know when she'd come home, you were trying to figure out, am I going to be able to show up for her in rehab? Will there be different rules? And trying to prep for that and train her to use the phone, or think about advocating for nurses to be able to call you so you could still remain kind of her consistent support. And you did that, and being willing to try Zoom and lots of different layers of challenges. And I think some of the lessons I've taken away from just watching you are just that kind of acceptance, and also just willingness to keep chipping away at whatever way you needed to show up for Pam, and be flexible and open to things changing on a dime, and kind of constantly advocating, sometimes being a calm, present, making the nurses laugh. And I think having them take you into the fold, and, really trusting you too, that you know her best. And there was some really nice relationships I think developed in these different.
Yeah, I've met a lot of amazing people along the way, and lots of different hospitals we've been in, Mass General and Salem and Boston Medical Center. And yeah, you're right. And thankfully I don't have much other activities in our occupation I'm involved in. I'm retired, so that gives me the time, thank goodness.
Eric, I think that sometimes you're humble, but this is incredibly hard work. It's incredibly hard work to respond to all the ups and downs that happen when someone is acutely sick. There's ways in which it's harder when someone's in the hospital, and there's ways in which it's harder when someone's at home. It's all hard sometimes, and good sometimes too. And I think you're both incredibly gifted at finding humor, but also like staying present. And I've been grateful to see you also be able to accept some stuff for you. So I think as we think about kind of caregivers as like a piece of the picture, I just think that how could a model that wasn't flexible and responsive ever work to meet the needs when that's what's happening in care? It's really hard to think about how it could be a match. So I really appreciate both of you being here and look forward to learning from you more during the breakout session too. Thank you so much for sharing that. Yeah, no, please stay and like talk more with us. And I think it's a really important piece of what this past year has been like. And there's a lot for us to learn together.
Yeah, I have a long story.
we all do. And I think that the reality is you're here, you're in it. And your voice as a caregiver is really important for us all to listen to. So thank you very, very much. I'm going to share my screen just because I want to take the moment to recognize our Bridge Award winners. We are if you guys can see that, you can let me know. Can you see it? I wanted to start with Judy Guttelman. I'm not sure if you're still here, but we were so honored that Dr. Plover had nominated you. It has been our privilege to work with you and get to know you over the past year and learn about your story as a breast cancer survivor, advocate, educator, speech therapist, born in Argentina, who is bicultural and fluent in Spanish, English, and Portuguese, and has built a wonderful nonprofit that's committed to engaging Latina women with breast cancer, providing services in Spanish to meet people where they are. And she has done an amazing job to transform this platform into a virtual platform during COVID-19. Congratulations, Judy. We're so grateful to honor you.
Thank you, Dr. Irwin. I'm still here.
Bueno, felicitaciones, es un honor.
Muchas gracias. Gracias por la nominación y gracias por este honor.
Thank you. Really amazing people to pause and be grateful for in the world. Next up, Chen-Chi Huang, who's the founder of the Asian Breast Cancer Project and executive director of Asian Women for Health. Efren, if you're on, if you want to join me in acknowledging Chen-Chi, feel free to jump in and interrupt me.
No, she's a strong advocate and absolutely, somebody that has continuously been advocating and raising awareness, some of the issues that have been happening, health issues that are happening in the Asian American community, and somebody that has really been open to collaboration and also to finding new ways of delivering care to make sure that the community is not left behind, while also trying to navigate the current social atmosphere as well. So absolutely an inspiration for many of us in the space, and definitely a well-deserved award in recognition for the incredible work that she does every day.
100%. Fierce advocate on the macro level, but also someone that, if you are working with someone who is Mandarin speaking, who has having challenges accessing care, she's a person you can call who will be on the ground helping you. So she really is present on all levels and deeply committed to this work. And it's our privilege to collaborate with you and honor you today, Chen-Chi.
Thank you. I didn't have any speech prepared
okay.
because I didn't know that I was supposed to talk.
No speech needed.
No speech is needed. All the work that you do every day is more than enough. This is to honor you and your work.
Absolutely.
Thank you for what you're doing.
Yeah, thank you. I just wanted to thank you all for giving me the opportunity and giving me this award. And it's really a community effort We are a peer-led, community-based nonprofit, and our mission is to advance Asian women's health and well-being through education, advocacy, and support. And we are also the founding member of an annual conference called Asian American Mental Health Forum. And it's free and open to all. And we often incorporate peer voices in the conference. So that's very unique. And the reason why I got involved with the mental health field was because when I was treated for breast cancer, I had a drug-induced psychotic manic episode. So it's a issue that's very close to my heart. And I often tell people that the most scariest thing during my cancer journey is not about losing my life or my breast or my hair. It's actually about losing my mind. So I really, really appreciate what you are doing, trying to bridge the gap. And some of you may know that Asian Americans are 3 times less likely to seek mental health services. And so we have a program called Achieving Whole Health that's culturally responsive and gender specific for Asian women. And because every time when we have issues like this, first of all, we will go to our friends and family. So we thought that this is a best way to intervene before any crisis escalated. So thank you again for your support, and we look forward to collaborating with you.
Thank you so much, Shin-Chi. I greatly appreciate the fierce reminders and advocacy for the need for cultural humility, the need to make sure we're being thoughtful about the different Asian American communities. And that's really something that, you've really, I think, taught a lot of us about, and I hope we can continue to grow in that work together. All right, next up, it's a team award. So this is for 2 amazing people who I get to work with in a grant, but also that Dr. Beverly Moy had nominated today. So Isabel Piccardo is a patient navigator in the Mass General Cancer Center. He was originally born and raised in the Dominican Republic. He has a history as a soldier, as a teacher, as a case manager. He's getting his master's in ethics. He is a person who goes above and beyond to ensure that he is reaching the people he is working with. He's also someone who asks tough questions and keeps it real and challenges people to make sure that we're thinking about what matters. We're very grateful to him for that. And part of the team award, Mira Ravkova Mejia, also a patient navigator at Mass General Cancer Center, who just brings an incredible depth of knowledge, skill, compassion to engaging many people affected by cancer, served by the community health centers, not just because she's fluent in many languages, but because she's an incredibly skillful listener and advocate. Dr. Moy, if you're here, I'm not sure if you're still here, if you want to add anything. We're just so excited to congratulate Isabel and Mira.
Yeah, so I'm here, thank you. I mean, I can't think of anyone more deserving than Isabel and Mira for this award. They have tirelessly advocated for our newly diagnosed cancer patients who receive primary care at our community health centers at Mass General in Chelsea, Revere, and Charlestown. And nearly a third of those patients have concurrent severe mental illness. They meet patients where they are. During the pandemic, they tirelessly called patients, made sure that they removed barriers to all their cancer-related appointments, would meet them at the hospital, and very significantly reduced missed appointment rates among this very vulnerable population with their kindness, compassion, and just genuine care. So I can't think of anyone more deserving. I'm so honored to work with both Mira and Isabel.
Thank you so much. I think that it's such a wonderful kind of team that we can think about together whether it's engaging peers, navigators, all of us together. And absolutely, it's a privilege to honor Isabel and Mira. Congratulations to both of you. All right, so we're going to spend just about 10 minutes before we go into the breakout group, and I'm just going to highlight some high-level key findings that our community of practice has come together to learn. Our community of practice, it's a group of people who have a shared mission, who do a shared activity together, and by doing it together, we get stronger. So our question was, how can we meaningfully engage people who are affected by mental health disorders and prevent widening of disparities during the pandemic, particularly for older adults, particularly for those from Latino communities and those in group living environments who we knew were facing higher levels and worse outcomes from COVID. What can we do? So the first key finding from our work together is really about language. The fact that our words matter, that's the first way we meet each other, that we interact as humans, and that we recognize dignity and humanity rather than an illness or a disease. So person-first language is a guideline that can help us get there. I've been really gratified to see this emerge also from the lung cancer community. So it's great to see guidelines emerging from many different organizations about person-first language. So we want to say, like, we want to think about not just a cancer patient, but instead a person with cancer, or a person with schizophrenia, or a person with an alcohol use disorder, and rather than a subject in a study, a participant. And hopefully we can also think about how to avoid language that is blaming of people who are working as hard as they can to get care. So rather than a no-show, maybe it's a missed appointment. Rather than a difficult patient, it's a challenging situation. Rather than non-compliant, people are unable to do something because of a barrier that they're facing. We need to move away from blame-based language to help decrease shame and make it more possible for people to receive care. This comes up a lot with people who have a history of smoking. It comes up a great deal with people who have a history of mental illness. It comes up in many different ways for many different people, many of whom have experienced a lot of trauma from our healthcare system. So it's on us to do better. And similarly, avoiding language that is both imprecise and shaming is really helpful. So here are some examples of that. Rather than saying that's crazy, you might say that's unexpected, and trying to avoid using a mental health disorder as an adjective for someone's personality, and being as precise as we can, as specific as we can, because that's actually clear communication. When we talk about country of origin or an age range or a disorder, let's try to be as precise as we can with our language. All right, so this was our community of practice, and it really speaks to the community that's together here today. Who do we need to bring into the room to move this work together? Caregivers, people who are peer specialists, mental health advocates, clinicians, oncologists, health disparity researchers, and all of us together, we're doing this work to think about how we can develop what we call a toolkit to advance digital health equity and really establish best practices. And today in the breakout sessions, also think about how do we spread the word so that the people who need to hear this message hear it in all sorts of different ways. So the key domains we focused on were trust, accessing technology and mental health care, and how to adapt our interventions for older adults in the Latino community. And we'll talk about that more in the breakout groups. So when we last came together at the Working Summit in May, we had these breakout groups. We were focused on how do we effectively build partnerships? How do we improve access to mental health care? How do we develop trust? How do we partner creatively? And how do we increase the reach and sustainability of virtual care and digital tools? And we asked you, what frustrates you most right now? What worked well? And going forward, what matters most to you? And so we incorporated that into the toolkit. And the toolkit is ready, it's here. We'll send the link in the chat, you guys can access it, and we'll send it out by email. But we really want it to be a living document. And so I wanted just to highlight a couple of key messages that then we'll explore more in the breakout sessions. So what can we do when there's a lack of trust? The key best practice that emerged is to call for a person-centered, team-based approach, to begin with patient and caregiver needs and listen and engage as a human first, and think broadly about the team that could be present and the different people who might make up that team. And to do what you say you're going to do as a way of earning trust. What happens when there's limited access to technology or lack of comfort with technology? When there are multi-level barriers to accessing it, both financial, comfort, maybe worry about confidentiality, maybe lack of feeling like that it's particularly useful in your life. So what do we do about that? One key best practice is to assess patient and caregiver needs and preference and keep showing up. And think together about models that work that can build capacity for care delivery in the community. And one key model that's an amazing best practice is the Genesis Club, a clubhouse in Worcester, Massachusetts. And I wanted to ask Ruth Osterman just to say a few words about what has happened in the clubhouse, how she's made this in partnership with community members into a really active, vibrant virtual community that's been able to maintain that engagement during the pandemic.
Hi, so thank you, Dr. Irwin, and thank you for inviting me. This is a new group of colleagues for us, and it's wonderful to be here. So I hope folks have heard about a clubhouse. A clubhouse is an intentional community for people with serious mental illness that's really organized around what we call a work order day. People come to the clubhouse to help us run the organization and do that together. So Genesis Club has been in Worcester for 33 years. We have 600 active members. Active means they've used Clubhouse services within the last 4 months. And telling our story about what happened in the pandemic, our service connections with members were people coming to the club, us going to see them at a job site or in their home, and telephone calls. And as the pandemic, the lockdown was looming, we weren't quite sure what was going to happen, but if there was a possibility we wouldn't be able to come into the building. So staff took home the phone numbers of all of our members, all 600. And then it happened all of a sudden. I should also say, we're an international training center for Clubhouse programs. And because of that, we have a WebEx system that we were using purely for training, but not really for internal purposes. So when the lockdown came, our mantra was call every member every day, and that we would all meet together through the WebEx system at 9 o'clock every morning to check in, see how things are going. So those were our established structures. Within that first week, we really realized that staff calling members every single day was against sort of our model, where we were running the organization together and members were participating in the work, but also staff were equally as anxious, nervous, scared, unsure, uncertain about what was going on. So we started engaging members right away in that work. We also realized within the first or second week, the digital divide, which we hadn't really tuned into before because members were coming in and we were calling them on the phone. So we luckily obtained a $10,000 grant from the Greater Worcester Community Foundation to bridge that divide. And our work has been meeting people where they're at, and then moving them into a device that they're ready for when they're ready and at the next step. So because we were calling members every day, a member might say, boy, I can't come into the WebEx meeting at 9 in the morning because I only have a flip phone. Well, would you like to get a smartphone? Would you like a tablet? How would you like that to happen? So it was very individualized, took a lot of time and a lot of patience, but and then we could talk a person through how to load their new device, how to get the app on the phone as their therapy and psychiatry appointments were all using telehealth. We helped them access those. and upgrade their technology. So I think that's kind of the big picture story. You know, a year and a half later, or almost 2 years later, we're still doing it, because what we really realize is there isn't, you know, this is, you're all set now. Technology needs change. So somebody who was willing to move from a flip phone to a smartphone now is wanting access to a tablet or a larger screen or something with more capacity and more apps on it. And so I think we will never stop paying attention to helping our members get the technology they need and use it. The other thing that, you know, the pandemic really isn't over. So we are now open as of this summer in full capacity, masked, but about 200 of our members still are only using the Clubhouse virtually and remotely, and not yet ready to sort of come in. So we all of our meetings, everything we do throughout the day is offered through a Zoom link or a WebEx link, depending, or you could join through the phone, we'll text, we'll email. So we really learned how to stay in touch with our members very regularly without them having to come into the building.
Ruth, in the chat, people, first of all, are saying what an amazing model this is, and that it generates hope, but also wondering how people become members.
So you can go on our website, and there is a referral form. If you can get to Genesis Club, you can come in. The eligibility is a serious mental illness, but no other eligibility. Simple 2-page referral form that can be emailed, faxed, mailed to us.
Do you have to be from Worcester?
A Clubhouse is voluntary, and that is intentional too. We're building self-efficacy and self-esteem through people making choices about the opportunities in the club. So it would start with somebody coming in, taking a tour, and deciding whether this is a service they wanted. We also have a virtual tour on the website that people could take a look at preliminarily.
Thank you so much. Really, I think a lot of, you know, I think psychiatrists and also physicians don't know about the Clubhouse model, and it's such a key part of recovery. And I just think it's been really inspiring to learn more about it, and hope we can collaborate more going forward.
Well, and I think having, and Dr. Irwin, you and I talked about this, having that intentional community, another tenet of the Clubhouse model is you're a member for life. And that certainly doesn't mean you're going to be coming every day for the rest of your life. It means during a period in your life where you need us, you're coming in. Some of our members we don't see or hear from for 5 or 6 years, but the access to return is immediate. And we had over 150 members who had disengaged from the Clubhouse for years returned through remote access during the pandemic because it was such a scary time. So that lifetime membership of an intentional community of support is key.
It really is. Thank you so much. All right. So with that, we felt today that rather than me going through bullet points, it would be much more helpful to really hear stories and best practices about how people are bridging this digital divide. We can, you know, get back into the bullet points later, but I think the stories are really what we want to hold in our minds when we think about our challenge over the next 25 minutes or so in these breakout groups, which really is, how do we grow this work together? How do we continue to make progress to close this digital divide, to increase access to clinical care and recovery services for the people who need them, to help other people learn how to build trust, and to think about meaningful research to answer questions that matter in partnership with community organizations. So in your room, we're going to go in just a second, but think about this together. Think about it as a challenge. Who do we need to get in the room together to move this forward? What audiences do we need to target? What's one next step we might take, and one out of the box idea? We can just hold those questions in our mind and go to the breakout groups.
from those next steps. And also to recognize some more Bridge Award winners, because it's been a year and a half or more. That's right, Leva, it's good. Not quite yet though, because we still have some good stuff coming, but soon. Okay, so maybe we'll transition to the Bridge Award winners, and then we'll have our closing discussion and share our creative ideas together. Let's see if I can do this. Sorry, there's a bit of a delay on my screen. Okay. So
I am, and I'm very excited to talk about the nomination for Danielle Lorino, who I've been able to get to know through our virtual tumor board. Danielle's a registered nurse who works with Elliott, and she has over 15 years of experience in clinical settings, and she's just an incredible support for the patients that she works with. She's organized, she's dedicated, she's compassionate. She is doing the work that needs to be done. And her, and so Christina Saracola is here from Elliott just to say a few words about her.
Thank you, Amy. Yeah, I'm going to speak about Danielle on behalf of her supervisor, Jessica Smith, who wasn't able to be here today. And I've known Danielle just for a short time, but wholeheartedly agree with everything that you just said and all of the wonderful things that Jessica said. Danielle really has demonstrated the characteristics of what it means to be an exceptional nurse. She's super person-centered. She, we serve a population that's pretty vulnerable and in a system that doesn't always have the resources, necessary to help our individuals. She comes with a holistic approach. She's really provides comprehensive care. She's so committed, and the other day I have to say, she's so committed to the team that she works on and the individuals that she works with, but we'll work across teams. I approached her last week and asked her about an individual on another team who's had a reoccurrence, who we're going to be referring back to the tumor board, and she didn't, hesitate. Absolutely, I will, I'll reach out to the team. I will work with this individual. She said, she really looked at me and said, I'll take everyone, that is struggling with this. So we are really lucky to have her. Again, she's person-centered, she's dedicated, and really, really works side by side with the individuals that have been diagnosed with this and supports them in their recovery. And it's amazing. Appreciate it. Thank you, Danielle.
Thank you, Christine. Thank you, Danielle.
Thank you. I appreciate it. I mean, I couldn't do all the stuff that I do without my team either. Everyone on my ACCS team really helps support me and helps do a little bit of legwork for me so we can all bring it together and make sure our clients are getting everything that they need. So I do work with a really great team, and I have some really great nurses that I work with as well that really help kind of just pull it all together. So thank you. I appreciate it.
I don't think it's always easy to ask the hard questions, the follow-up questions, even when you're new in an organization. And Danielle has reached out proactively a number of times being like, well, maybe we could do this. I was thinking that maybe I could just show up here. And I can't tell you how much I appreciate your persistence and skill in accompanying people with complex needs. It's seen and valued.
Thank you.
You're welcome.
Thank you.
Awesome. Our final Bridge Award winner for this year, and we'll have the chance to come together again and celebrate people in greater detail, but wanted to take the time to acknowledge is Dana Haggett, who's a nurse practitioner in medical oncology at the Mass General Cancer Center, who's been a wonderful partner in this work together. She is a person who is so person-centered, thinks of things like people's birthdays and, bringing the team together to celebrate people with humanity, but also as a fierce advocate who makes sure everybody's on the same page.
and that people are getting expert care. So I think that Dana and Jen are here in the room. So I'll turn it over to you guys. Dr. Shin, do you want to say a few words?
Sure, I'd be happy to. Can everyone see me? I just logged on.
There you are. Thank you for jumping in from clinic.
Yeah, of course, it's an honor and a privilege to be here today to help us all celebrate Dana, it's such a deep privilege to work with her and be her colleague and learn from her. My name is Jennifer Shin. I'm one of the breast oncologists and palliative care physicians here at MGH. And I have the deep privilege of working with Dana in our breast oncology clinic. I can't even tell you enough. I don't even know where to begin, but I can say that when I think about the very large disparities and the care that people receive for many reasons, and one of them being severe mental illness, I can say that practicing alongside of Dana helps me really feel like we can both really take care of somebody. And this idea of once somebody enters into our care, how do we really give them the outstanding care, just like everyone else that comes into the cancer center. And I can say that Dana goes above and beyond to make sure that we are practicing at that same level for everyone that enters into this space. And certainly for Dana, you know, like Kelly said, whether it be things like just being so patient-centered. And I think the real thing is seeing that connect with them and to let them know that we really care about them and going that extra mile, because I think those people with severe mental illness really struggle for many reasons. And this idea of, you know, Dana's on her own, bringing them in for extra visits, checking on them, calling them, connecting with other team members, reaching out across, the cancer center and MGH to make sure all of us are connecting about somebody's care to make sure they receive that level of care. So I will say she goes above and beyond for every patient we see. And then I say for our most vulnerable, who include those with severe mental illness, at that level of care, and does so with she learning and inspired by her every day. And so it's such a deep, deep privilege for me to be here to be able to congratulate her alongside all of you. So thank you, Dana. We are so lucky to have you here, and our patients are so lucky as well.
Thank you so much. We're so excited for you, Dana. We're glad you're here too. I know you're in clinic too, but just to hear those words that are so well deserved.
If it's okay, I'll just say thank you so much. I was so surprised and so honored to get this recognition. I definitely have learned how to take care of this specific patient population by working alongside Dr. Shin. So she's been a big, great, wonderful mentor to learn from. And then especially working alongside with Dr. Irwin and Amy Corverlin, I really feel well supported in helping to take care of this specific patient population. So thank you again. I'm so sorry. I would have loved to have joined the entire conference. I had gone a couple years ago, and it is a really wonderful conference, but Fridays tend to be the
part of the stakeholder board. Don't worry about it. We know you got deep commitment. No worries. And we appreciate that you're here. We're all doing what we can do. So no worries at all. We're grateful for the time that anybody can contribute to being here today. It's Friday. There's a lot of places you could be, and the fact that you're choosing to be here with us, I'm grateful for it. And I think in our last, 15 minutes or so, 19 minutes, we certainly will end on time, because that's a big part of doing things and being respectful. But we really want to think together about what we've learned in the breakout sessions. And I know that's never enough time, but the ideas that were generated there, we'd love to hear those ideas together. And we are, maybe in the background, going to try Google Jamboard, which is a way to put like colored Post-it notes up with all these different ideas, and we can try to share that at the end. Is there a group that wants to start?
My group will go.
Excellent.
We had a fantastic discussion in the training and education group. We were, very fortunate to have some people who shared their stories and who were able to talk really directly about how losing trust and a lack of engagement impacted their care. We were tasked with like a next step and an out of the box idea. we had several that I thought were great. One of which was just incorporating peer support more. And I know that it was also a theme in Rob and Amy's group as well. And really thinking about how information is directed to patients. So we talked about how sometimes patients find out their cancer diagnosis on the portal, on their cancer care portal, and how that impacts engagement. And we also talked about how a goal of training professionals could be to incorporate more training on how to deal with a patient's distress, how to learn more about treating psychiatric illness, and not really just seeing it as a psychiatrist's job. But Diana Hannan, who is trains a lot of nurses, talked about how she really makes it clear to her trainees that this is that psychiatry is not your job. Like, it's your job is to treat the whole person. And that was a big theme in our meeting as well, is just to look at the whole person. People have jobs, they have other people they're caring for. They're not just about their cancer illness. And we, I think that kind of covers everything quickly. One idea that someone in our group brought up that I thought was a really interesting one is perhaps having a card that providers could carry in their pocket or wear on their ID badge that would give some person-centered language to use when working with someone who's in distress or in crisis. I think Tricia Hennessy was talking about how that's been a goal of NAMI in working with their family-to-family groups to train police officers who then have access to that card when they are called out to a situation where it would help to build trust if they're using more person-centered language. Did I forget anything? I might have. I did take some notes, and I know Samar took excellent notes. So anything else, guys? People? Thank you so much for being a part of the group. It was great discussion.
Awesome. Maybe Rob and Amy's group. And I'm just going to give you a sense if you're not seeing the Jamboard, I'll just show it to you for a second when I start talking because it's kind of cool.
Of course. So we also had a wonderful conversation in our group. And so we were focusing kind of on like peer support and bringing in more voices and how we can help provide this better access, especially in a digital world. And one example came up of how, thankfully, an individual who was receiving treatments, they had a social worker in the room with them. And, the medical doctor was just providing all of the information, but that can be extremely overwhelming, right? Especially to someone who lives with anxiety or other severe and persistent mental illness. And they were very fortunate to have someone to be able to kind of pause the doctor for the second. Okay, let's slow it down. Let's bring it back to basics to make it so that information was a much more easier to retain and to process for the person who was there and receiving services. So a big part of that would be having peer specialists in the room with somebody, or social workers, or anyone really, family members even, who can help advocate and who knows that person best. Because again, we're talking about the whole person, right? So if we're thinking about all of that, we're able to help guide those appointments and make it easier to kind of process. Some other things that were highlighted of whether it's medical or with mental health struggles is being mindful of the appointment times. Some people need to be able to sleep late, whether it's from specific challenges or pain challenges or whatever it is that they're living with at that time. And writing down those appointments and remembering them can be two wildly different things, especially when you lose the routine of getting in your car, going to your appointment and everything else, just kind of rolling out of bed and logging on. There's also the importance of not assuming that people know how to use the digital support. I'm like, oh, here, I'm just going to log you on. You're good. You just got to click this button. And sometimes, you need to revisit that numerous times to be able to take that one stressor off of that person's plate. It's one less thing that they need to be able to worry about. And some of the other things that we thought about going forward was, can we incorporate IT into the conversation more? Oftentimes we have these barriers where people's audio isn't working or everything else. So to be able to have an IT person there, that's again another stressor that's taken off of the plate for us to be able to really focus more on the support that's being provided. And then lastly, exploring how we can keep this going through insurance. Obviously, insurance companies run a lot of it. So in a post-pandemic world, and now that we've seen that it is a viable resource, how can we coordinate and really promote it to make sure that it's still going to be available later on?
Absolutely, for sustainability, people who are deciding insurance stuff, whether they be like insurance people, people from government need to be in the room and part of the conversation. Absolutely. Next group.
We can go next. So it was a very fascinating conversation. We also touched upon some of the points that I mentioned. For example, the element of community and having peer groups, especially for women dealing with breast cancer. Examples of Dana Faber and how they've been working in places like in Chicago. It was really fascinating to see how women can come together to really work in some of the challenges they have been doing together. A very important aspect I was mentioning in our group was the time that it takes to build trust, especially when we're talking about the Latino community. Is not emphasizing that in order to achieve that trust, there are certain steps that need to be achieved one by one, and then they may have different timelines in order for us to keep moving forward in trying to fully engage that community. Also mentioned about how there is a willingness in the community that they do want to access care, but many times there are many barriers that may include logistics, access. Also mentioning how there is not enough mental health literature for patients to have access to. Also the lack of more psychologists who speak the language, so they can be more culturally appropriate for the patient and create more access to the patients. So that also answers the aspect of capacity. And then two other very important elements was education, both for providers and education for the patients. But when we talk about education, we were talking about not having necessarily say, let's talk about mental health, but having more like a discussion and maybe playing a little bit with the language instead of having, oh, let's learn about this. Let's talk about so-and-so. And in Spanish, we use the term charlas, and that's something very interesting someone brought into our group. And the last point, being persistent about our engagement and our goal with the community that we're trying to target. Hopefully that makes a summary of what we're talking about, but more than welcome if someone in the group thinks that I'm missing something. But thank you so much for sharing.
Yeah, thank you so much, Isabel. Go ahead, Jenny.
Isabel, that was a fantastic summary. And just for the group at large, when Isabel said charla means to chat. So it's the meaning to bring it down to a more informal level. So it's like, oh, let's chat about, or let's chat with, this person, right? Instead of saying like, oh, we're getting this. There's an appointment that you have with Dr. So-and-so, and it's about bringing it down to a more informal, less stigmatized level that to make it more approachable.
Thank you so much, Danny. I really appreciate that. And I thank you for being here too. I think that was one of the key take-homes from the community of practice, that those moments really talking with each other about, charlando, against people about what we like to do, what's going on, checking in. We don't know what's going on in people's lives. There have been so many disasters and horrible things happening. If we don't take the moment, to ask, and I think that the members of the community of practice have done such a good job of reminding each other. And that's where the relationships, I think, have come from. All right, research. Friends, I can do it if you may be in clinic.
I'm happy to do it. I want to, there's like a very rich discussion to the group. So I want to say thank you to everyone for participating. One of the things, I'm on many things, right? So building trust doesn't happen overnight, right? So you cannot expect to have a true partnership and without investing the time and resources to develop it. At least some of the highlights in terms of like having flexibility and having the community influence the research agenda that you may be developing, but also to like be able to accommodate some of the pressing needs that, or things that may occur more urgent in the community. And Dr. Burns, or Karen, I'll do a shout out. One of the things that you said is like you have to show up, right? And when we say show up, it's like show up for the community, be there for the community, and then truly engage the community by working together. And then another thing that we discussed over time is like the different, how we have to think about redefining disparities or communities in terms of, it could be related to age, Asian American, it could be Latino, it could be other African American. It doesn't matter what we learn in this process of community building, co-learning, and working together to co-develop the agenda, is that these are building blocks that will serve as a foundation to build a better future, that and making cancer care or care in general more accessible for all, and research should be seen as one of those pillars as well, not a separate agenda.
Absolutely. And if anybody else wants to jump in just to build on that, I think there was also a real call to, change the infrastructure of funding that is available, that there's a new model of funding that's needed to support the investment in time and shared skill sets that's needed for meaningful community partnership and establishing trust. And I think that, it's slowly getting better, that there's more like recognition of this, but there's much more work to do. And I think a lot of creativity needed in terms of thinking about where that sustainable funding can come from to support people's time to do this work, and be able to bring their strengths together. Did anybody else in the research group want to add anything about that? I think it was a great group of people coming together, and I'm just optimistic about the strengths in the room as we think about kind of doing more work together, whether that work looks like training, whether it looks like a new model of clinical care, whether it looks like a research study or advocacy or policy work. There's lots of forms it can take, but we really hope to bring the strengths of the people in this room and beyond into that discussion so that it can get stronger and build from the coalition that we have now. It's wonderful to have people from like Ireland and UK and throughout Massachusetts, and I think Washington State probably over there, coming together with a shared commitment to this work. So I just wanted to close by thanking you for being here and letting you guys know some ways that you can be involved going forward. Hopefully I can find my slides. So this is my thank you, especially to the members of the community of practice, especially to Laurel and Eric Worth for sharing their stories today, for all of you for being here, for our many generous supporters, and just for folks who are kind of like, yeah, do think outside the box, be passionate, care about something. I'm very grateful to the people who say that, who listen, and whose first response is, why not? It certainly helps me. And I think I'm really grateful for the time I've been able to spend together with the community of practice and stakeholder board, and how much we're able to bring, our identity into the room together. That's really been personally meaningful to me. And I hope that it is a way to, continue to grow our capacity to do good work together, but also build our relationships. So ways to kind of be involved going forward. Our great CRC team, has organized a book club coming up. Called Kimiko Does Cancer. And so if you want to give the 10 seconds on Kimiko Does Cancer, if you're here, or Amy again.
Yeah, I'm happy to give the 10 seconds, and I'll put it in the chat as well. This is a graphic memoir of a woman named Kimiko who's queer and mixed race and had previously been healthy and then was diagnosed with breast cancer at the age of 25, and found that she really did not resonate with the pink ribbon narrative around breast cancer. She also had a lot of mistrust in the medical system and felt that her identity was sometimes either disrespected or that there wasn't person first care. So she talks about her reflections with breast cancer, and mental health. And it's a really powerful memoir. It's also free at the Boston Public Library, in addition to being able to get it at bookstores locally. So I'll put the optional registration in the chat.
Thanks. The book clubs have been a great way to just come together to discuss something different. Just come together as people. Also, we are the coalition of the Engage Initiative, started in like 2017 and now has more than 800 members. And we're grateful that all of you are part of that work. Stay tuned for invitation to apply to join the stakeholder board, which is our governing body, which meets monthly and provides guidance about our priorities for clinical care and advocacy and research, and really brings a diverse group of people together. And your time is compensated for that work. We're hoping to really be intentional about bringing together underrepresented groups in that stakeholder board too, which includes representation of people who have a history of mental health disorders, also underrepresented communities, whether that be due to socioeconomic status or race or ethnicity. So we can think intentionally about how we're going to grow our work together. And then just more broadly, if you want to be involved in any of our work groups or in future events, I would encourage you to reach out to us. You can email mghengage@partners.org, or of course you can email me, or Amy. And we really just wanted to say thank you for spending this time with us together. And I know Emily has an evaluation that she put in the chat. So it's fastest just to click on it now. I give you 2 minutes you have before you get it done. If you want to, we'll also probably we'll send a follow-up email, and we'll share the Jamboard with all these amazing ideas. I mean, look at all these amazing ideas. Back in the day, we did it with real Post-it notes, but it's cool to see these Post-it notes too up here. So we'll work on distilling that and getting that to you guys. Happy Friday. Hope you guys all have a wonderful weekend.
Thank you.
Thank you.
Thank you.
Thanks, Kelly.
Thank you, Kelly.
My pleasure. I appreciate everybody being here and your time and leadership in the work. Hi, Eric. Thank you so much.
Bye, everyone.